Welcome to the Deep Microbiology channel. In today's lecture, I will go in depth into the high vaginal swab test, focusing on why this test is performed and how laboratory results are interpreted. Let's dive in. The vagina is a complex ecosystem that contains a mixture of microorganisms, including bacteria and fungi. When these microorganisms remain in balance, they protect and maintain vaginal health. The dominant beneficial bacteria in the vagina are Lactobacillus species, which are gram-positive rods. They play a crucial role in maintaining vaginal health by producing lactic acid, which keeps the vaginal environment acidic. This acidic pH prevents the growth of harmful pathogens. In addition, Lactobacillus produces antimicrobial substances such as bacteriocins, including acidoline, lactocidin and lactocin B, and hydrogen peroxide, all of which help inhibit pathogenic microorganisms. In simple terms, Lactobacillus acts as the vagina's natural bodyguards, protecting it from infection and maintaining balance. Now let's take a look at how hormones control the vaginal environment. In healthy women of reproductive age, estrogen plays a central role in controlling and maintaining the vaginal environment. Estrogen acts like a regulator that helps the reproductive organs grow and function properly. It stimulates the growth of the uterus, vagina, and fallopian tubes, ensuring they reach and maintain their normal size. Each month, estrogen thickens the uterine lining, endometrium, to prepare the body for a possible pregnancy. If pregnancy does not occur, this lining sheds during menstruation. Estrogen also keeps the vaginal lining thick, elastic, and well lubricated by increasing blood flow and maintaining healthy tissue structure. One of estrogen's most important roles in vaginal health is its effect on glycogen production. Estrogen causes the cells of the vaginal lining to store glycogen, which acts as a source of energy for beneficial bacteria called lactobacilli. These good bacteria break down glycogen and produce lactic acid. The lactic acid keeps the vaginal pH acidic, usually between 3.8 and 4.5. This acidic environment protects against harmful bacteria and infections, helping maintain a healthy balance of microorganisms. As you can see in this image, the estrogen receptor on epithelial cells allows the cells to deposit and store sugar as glycogen. When epithelial cells exfoliate or undergo lysis, they release glycogen, which is catabolized by alpha amylase in the vaginal lumen into smaller polymers. These polymers are subsequently metabolized into lactic acid by Lactobacillus species. Lactic acid acidifies the vaginal environment, favoring the proliferation of lactobacilli and inhibiting the growth of infection-associated organisms. Now let's take a look at how vaginal environment changes across the female lifespan. Understanding these changes is important because hormones strongly influence vaginal pH, microbiota composition, and the structure of the vaginal epithelium. The first stage occurs during the neonatal period. At birth, the newborn's vagina is initially colonized by bacteria from the mother, particularly Lactobacillus species. During this time, the first month of life, the infant is still under the influence of maternal estrogen that was transferred during pregnancy. This hormone stimulates the vaginal epithelium to produce glycogen, which serves as an important energy source for lactobacilli. As these beneficial bacteria metabolize glycogen, they produce lactic acid, which helps maintain an acidic vaginal pH and provides protection against harmful microorganisms. However, this hormonal influence is temporary. After the first month of life, maternal estrogen levels gradually decline, and the vagina enters the childhood stage, which is characterized by a hypoestrogenic state that lasts until puberty. Because estrogen levels are low, glycogen production decreases, the vaginal epithelium becomes thin, and the vaginal pH increases, becoming less acidic. As a result, Lactobacillus species become less dominant, and the vaginal microbiota becomes more diverse, including bacteria such as Escherichia coli and Streptococcus species. During this stage, vaginal discharge in girls is usually minimal, and the vaginal tissue is more delicate. During puberty and the reproductive years, increasing levels of estrogen stimulates the vaginal epithelium to produce glycogen, which serves as a nutrient source for Lactobacillus species. As a result, lactobacilli become dominant and produce lactic acid, which keeps the vaginal pH acidic, below 4.5, and helps protect against harmful microorganisms. However, the vaginal microbiome changes throughout the menstrual cycle because of fluctuations in estrogen and progesterone. During menstruation, the number of lactobacilli, especially Lactobacillus crispatus, may decrease. The vaginal pH rises, and bacterial diversity increases. During the last days of the cycle, non-lactobacilli bacteria such as Gardnerella species may temporarily increase before the lactobacilli-dominant environment returns. Pregnancy. This stage is characterized by high estrogen levels, which increase glycogen deposition. As a result, the vaginal microbiota becomes more stable and less diverse, with lactobacilli dominating, and a significant decrease in vaginal pH. In addition, many pregnant women experience an increase in normal vaginal discharge, which occurs due to increased blood flow to the vagina and greater fluid transudation from the vaginal walls. Postpartum and breastfeeding. Following delivery, the vagina enters a second physiological hypoestrogenic period. The number of lactobacilli decreases dramatically, and the microbiota diversity increases. Breastfeeding maintains this low estrogen state, which can lead to transient vulvovaginal atrophy, characterized by a lack of superficial epithelial cells and an increased pH. As you can see in this figure, there is a lack of superficial epithelial cells due to low estrogen levels. Estrogen normally stimulates the maturation and thickening of the vaginal epithelium, as you can clearly observe here. When estrogen levels decrease, the epithelium becomes thinner and loses the superficial cell layer. This condition leads to vulvovaginal atrophy, which is characterized by thinning of the vaginal tissue, reduced glycogen levels, and an increase in vaginal pH. The last stage is menopause. During menopause, the decline in ovarian function leads to permanent low estrogen levels, hypoestrogenism, which significantly affects vaginal health. As estrogen decreases, the vaginal epithelium becomes thinner, and the mucosa loses its elasticity and hydration, leading to a vulvovaginal atrophy. In addition, the reduction in estrogen decreases glycogen production. This leads to lactobacilli dominance reduces. As a result, the vaginal pH increases, often above 5.0, and the vaginal microbiota becomes more diverse, with more anaerobic and facultative bacteria present. These physiological and microbial changes commonly cause symptoms such as vaginal dryness, burning, itching, and dyspareunia, pain during sexual intercourse. As the vaginal environment and flora change across the female lifespan, any disruption in this balance may result in conditions like vaginitis and vaginosis. So, what exactly are vaginitis and vaginosis? Vaginitis, it is a general term, refers to inflammation or infection of the vagina that causes symptoms such as vaginal discharge, itching or irritation, burning sensation, pain during urination or intercourse, abnormal odor. Simply, it is not a single disease but an umbrella term that includes several conditions. While vaginosis, it is a specific type of vaginitis, refers to bacterial vaginosis, a condition where the normal vaginal microbial balance is disrupted, rather than true inflammation. Why bacterial vaginosis causes little inflammation? That is due to several reasons. First, bacteria mainly grow on the surface of vaginal epithelial cells without invading the tissue, as we can see here. Since there is minimal tissue damage, the immune system is not strongly activated. Normally, when cells are damaged or injured, they release signals called danger signals that alert the immune system. In bacterial vaginosis, the bacteria mostly stay on the surface and do not damage the tissue, so these danger signals are not released. Therefore, the immune system does not start strong inflammation. Secondly, bacteria form biofilms, especially by Gardnerella vaginalis, which help them hide from immune detection. They also produce substances that reduce immune signals like interleukin-8, so fewer neutrophils are recruited. Normally, when body detects an infection, it produces a chemical called interleukin-1 beta. This acts like an alarm bell, telling another chemical, such as interleukin-8, to bring neutrophils to the site of infection. The neutrophils then fight the infection, often causing visible signs like redness or pus. But in bacterial vaginosis, even though interleukin-1 beta is high, interleukin-8 doesn't increase like it usually does. Why? Bacterial vaginosis bacteria release enzymes like sialidase and prolidase that seem to block or break down interleukin-8. Because interleukin-8 is missing, neutrophils don't rush in, so there's little inflammation and no pus. In contrast to vaginitis, bacteria and fungi invade deep into tissue. Cells get damaged, the danger signals activated, and the inflammation starts. Vaginitis can be due to infectious and non-infectious causes. Infectious causes, such as trichomoniasis, a sexually transmitted infection caused by Trichomonas vaginalis. Candidiasis, yeast infection, usually caused by Candida albicans. And bacterial vaginosis, due to an imbalance of normal vaginal bacteria. Non-infectious cases such as desquamative inflammatory vaginitis is an uncommon form of vaginitis. Although etiology of this chronic vaginitis is unknown, it is believed to be immune-mediated, characterized by inflammation and a purulent, odorless discharge. Atrophic vaginitis, genitourinary syndrome of menopause, results from estrogen deficiency, leading to thinning and inflammation of the vaginal epithelium. It is most common after menopause. Cytolytic vaginitis, also called lactobacillus overgrowth syndrome. This type of vaginitis is associated with increased vaginal acidity, which causes irritation and abnormal discharge due to high concentrations of lactobacillus species. It occurs when there is excessive proliferation of lactobacillus bacteria, resulting in the destruction of vaginal epithelial cells. Please note, we have also some conditions can mimic vaginitis. These conditions are frequently misdiagnosed as vaginitis because they share overlapping symptoms like discharge, pelvic pain, or burning, even though the primary issue is located elsewhere. These conditions, such as cervicitis, results from a sexually transmitted infection, such as chlamydia or gonorrhea. These sexually transmitted infections primarily infect the glandular epithelium of the cervix, endocervical canal, not the vagina. However, the mucopurulent discharge they produce collects in the vaginal vault, mimicking vaginitis. Herpes simplex virus. While it can cause classic vesicles, atypical genital herpes can present as chronic itching, burning, and a watery discharge that mimics recurring yeast infections. Human papillomavirus. Certain strains cause genital warts that lead to physical irritation and secondary infections, which may change the character of vaginal discharge. Urinary tract infections can cause burning, urgency, and frequency of urination, which may be confused with the symptoms of vaginitis. Pelvic inflammatory disease. This is an infection of the upper reproductive tract, uterus, fallopian tubes, and ovaries. Its symptoms, unusual discharge, pelvic pain, and fever, significantly overlap with vaginitis. Allergic reactions to products such as soaps, detergents, or feminine hygiene products can cause irritation and discharge similar to vaginitis. Bacterial vaginosis develops through a multi-step pathogenic process involving alterations in the vaginal microbiota, biochemical changes, and interactions with the vaginal epithelium. Here is a detailed explanation. Normally, the vagina is dominated by lactobacillus species that produce lactic acid and hydrogen peroxide. These substances keep the vaginal pH acidic and inhibit harmful bacteria. When lactobacilli decrease, less lactic acid is produced. As a result, the vaginal environment becomes less acidic and the pH rises, more than 4.5. This higher pH creates a favorable environment for other bacteria to grow, such as anaerobic bacteria, especially Gardnerella vaginalis, Mobiluncus, and other anaerobic organisms. These bacteria release decarboxylase enzymes that break down proteins and peptides present in vaginal secretions. This breakdown leads to the production of chemical compounds called amines such as trimethylamine and other polyamines. Amines make the vaginal environment more alkaline, which further raises the pH. At high pH, trimethylamine becomes volatile, meaning it easily evaporates. This produces the characteristic fishy odor of bacterial vaginosis. Meanwhile, Gardnerella vaginalis attaches to exfoliating vaginal epithelial cells. When these cells become covered with bacteria, they appear as clue cells under the microscope. Clue cells are a key diagnostic sign of bacterial vaginosis. Amines and bacterial activity cause transudation, leakage of fluid from vaginal tissue, and exfoliation, shedding of epithelial cells. These components combine to form the vaginal discharge, which is thin and homogeneous, gray or white, associated with a fishy odor. Laboratory diagnosis of bacterial vaginosis. There are several methods used for the diagnosis of bacterial vaginosis, including 1. Nugent score, microscope counting bacteria. 2. Amsel criteria. 3. Rapid test. 4. Molecular methods. The Nugent scoring system is used to diagnose bacterial vaginosis by examining bacteria in a gram-stained vaginal smear under a microscope. It works by evaluating 3 bacterial morphotypes: large gram-positive rods, Lactobacillus, small gram-variable Coccobacilli, Gardnerella vaginalis, and curved gram-variable rods, Mobiluncus. Normally, Lactobacillus is present in large numbers, which gives a low score. When Gardnerella or Mobiluncus increase, the score becomes higher, indicating an imbalance in vaginal flora. To calculate the score, 2 tables are used. The first is the Nugent scoring table, morphotype scoring table. This table is used during microscopic examination to assign a score based on the number of bacteria seen per oil immersion field. Each of the 3 bacterial types receives a score from 0 to 4 depending on its quantity. After assigning scores for all 3 morphotypes, the values are added together to obtain a total score from 0 to 10. The second table is the Nugent interpretation table, which is used after calculating the total score. This table helps interpret the result by classifying the vaginal flora as normal, intermediate, or bacterial vaginosis. Now let's see how we can do this practically. After performing a direct gram stain on a vaginal swab, we examine it under a microscope. Here we are looking at a vaginal secretion where we can clearly see some exfoliated cells that belong to the squamous cells that come from the squamous tissue of the vaginal region. So, to interpret this secretion according to Nugent's criteria, the first thing we're going to do is look at what types of bacterial cells we have in this slide. For example, look here, we have some elongated bacilli that are purple stain. This shape we see here is characteristic of Lactobacillus, which are part of the normal microbiota. Normally, the microbiota of this area is composed mostly of different Lactobacillus species, which are the ones that maintain the acidic pH of vaginal secretions. Then we must see if there are other bacterial forms, for example gram-variable curved bacillus, which we don't really see here in this stain, or gram-variable Coccobacilli, gram-variable meaning bacilli that may look the same but some appear purple and others pink. In this case, since we have more than 30 elongated gram-positive bacilli, we go to our Nugent scoring table. We see that having more than 30 gram-positive bacilli on this slide corresponds to 0 points. Since we haven't seen any small gram-variable Coccobacilli, that also corresponds to 0 points. And since we haven't seen any curved gram-variable bacilli on this slide, that also corresponds to 0 points. So adding it up, 0 points for gram-positive bacilli, 0 points because we didn't find gram-variable Coccobacilli, and 0 points because we didn't find curved gram-variable bacilli. That gives us a total score of 0. According to the final score, the interpretation is normal. Remember that normal vaginal flora has a score between 0 and 3. In this slide, epithelial cells are visible with few gram-positive bacteria, appearing to adhere to their surfaces. Gram-positive bacilli consistent with Lactobacillus species are present, approximately 6 to 7 bacilli per field. Additionally, smaller Coccobacilli are observed, which may correspond to Gardnerella species, greater than 30 per field. No gram-variable curved bacilli are present. Referring to the Nugent scoring table, 6 to 7 gram-positive bacilli, Lactobacillus 1 point. More than 30 small gram-variable Coccobacilli, Gardnerella 4 points. No curved gram-variable bacilli, Mobiluncus 0 points. Total score 5. According to the final score, the interpretation is intermediate. This means partially altered vaginal microbiota, but not diagnostic of bacterial vaginosis. Clinical recommendations: monitor and assess further depending on symptoms. Repeat testing later for confirmation. In this last case, you can see one epithelial cell is covered with numerous small gram-variable Gardnerella vaginalis, giving it a granular appearance. These cells are called clue cells. Another epithelial cell shows less bacterial coverage. The cytoplasm appears fuzzy, similar to shading with a black pencil. The edges of the squamous epithelial cells, which normally have sharply defined borders, become indistinct or stippled. The term stippled means marked with numerous small dots on a surface. Clue cells are considered a hallmark diagnostic sign of bacterial vaginosis. Referring to the Nugent scoring table, here we see more than 30 small gram-variable coccobacilli on the field. According to the table, that corresponds to 4 points. We don't see any curved gram-variable rods, so this contributes 0 points. There are no large gram-positive rods present. Normally, Lactobacillus dominates a healthy vaginal flora, so their absence is scored 4 points. When we add these up, 4 plus 0 plus 4 is equal to 8 points. According to Nugent, a score of 7 to 10 indicates bacterial vaginosis, which aligns with the microscopic findings we are observing. The second method is AMSL criteria, are used to establish a clinical diagnosis of bacterial vaginosis. A diagnosis is confirmed when at least 3 of the following 4 signs are present. 1. Homogeneous vaginal discharge. A thin gray or white, homogeneous vaginal discharge coating the vaginal walls. 2. Vaginal pH greater than 4.5. An elevated pH is considered the most sensitive of the 4 criteria. This increase occurs because the loss of protective lactobacilli reduces the production of lactic acid. To measure vaginal pH in the laboratory, a vaginal swab is collected and placed on the pH test zone of the indicator strip. The strip is then left for about 30 seconds, according to the manufacturer's instructions, to allow the sample to react with the indicator. After that, the color change on the strip is compared with the pH indicator scale provided with the test kit to determine the vaginal pH value. Vaginal pH can also be measured in the clinic, as shown in the video demonstration. First, take a sterile vaginal swab and avoid touching the tip to prevent contamination. Then gently insert the swab approximately 5 centimeters into the vagina, being careful not to touch the cervix. After collecting the vaginal fluid, place the swab onto the pH test zone of the indicator strip. The strip is left for about 1 minute, according to the manufacturer's instructions, and the color change on the strip is then compared with the pH indicator chart to determine the vaginal pH value. Vaginal pH. Important note: sometimes the vaginal pH test can appear high even when there is no infection, because certain things can temporarily raise the pH, such as menstrual blood, even a small amount not visible during examination, semen after sexual intercourse, products inserted into the vagina such as lubricants, vaginal creams, suppositories or medications. These substances are less acidic, so they raise the pH reading, and affecting in the result, meaning it may suggest infection when it is actually due to these external factors. Another factor that can affect vaginal pH measurement is the location where the pH strip is placed inside the vagina. If the strip is positioned too close to the cervix, it may come into contact with cervical mucus, which has a different pH than vaginal secretions. This can result in a falsely elevated pH reading. The third criteria is the presence of clue cells on a gram stain, as I explained before in Nugent's score section, or wet preparation. During wet mount microscopy, clinicians look for vaginal epithelial cells that are heavily coated with bacteria, which obscures their peripheral borders. These are considered the single most specific predictor of bacterial vaginosis. The last one is positive whiff test, also known as amine test. A fishy or rotten amine odor is detected either immediately or after adding a 10% potassium hydroxide solution to the discharge. This odor results from the release of volatile amines produced by anaerobic bacteria, as shown here in this video.
When the vaginal sample was collected, the swab was placed in a test tube with approximately half a milliliter of saline. Only have to take a drop of the suspension and place it on a slide, and add 1 drop of 10% KOH. Sniff the preparation immediately, using your hand to waft any odor toward your nose. This is the whiff test.
The third method used to detect bacterial vaginosis is rapid test, such as Awesome BV Blue test is a rapid diagnostic test which can be performed at the clinic, avoiding the time delay of sending a sample to the laboratory, and the results are available in 10 minutes. The test detects high levels of the enzyme sialidase in vaginal fluid. This enzyme is produced by BV-associated bacteria such as Gardnerella vaginalis, Bacteroides species, Prevotella species, Mobiluncus species. Elevated sialidase activity is strongly associated with bacterial vaginosis. Step procedure. 1. Collect a vaginal sample using a sterile swab from the lower vaginal wall. 2. Insert the swab into the test vessel containing reagent and mix gently. 3. Allow it to stand for about 10 minutes at room temperature, 17 to 37 degrees Celsius. 4. Add 1 drop of developer solution. Mix and read the color result immediately. The result depends on the color change. Blue or green color. Positive result indicates high sialidase activity, suggesting bacterial vaginosis. Yellow color. Negative result indicates normal sialidase enzyme levels, meaning bacterial vaginosis is unlikely. Molecular diagnostic methods. These methods focus on detecting specific bacterial nucleic acids, such as 1. Direct DNA probe assays. These assays involve introducing a DNA probe to a vaginal fluid sample, where it binds to specific sequences of a particular bacterium, such as Affirm-VP. This is a synthetic oligonucleotide probe test that detects high concentrations of Gardnerella vaginalis. 2. Nucleic acid amplification tests. Primarily real-time PCR, enzymatically multiply specific nucleic acid sequences exponentially, making them easy to detect. 3. Microarray analysis. This technology uses thousands of unique nucleotide probes on a fixed surface to detect known bacterial species through hybridization. 4. Next-generation sequencing, NGS. Microarray analysis and NGS. These methods are typically used in research or large reference laboratories rather than routine clinical practice. The other type of vaginitis is vulvovaginitis. Vulvovaginitis is a broad medical term that refers to inflammation or infection of both the vulva and the vagina. It is a general category that includes several different underlying causes. Candidiasis is one specific cause of vulvovaginitis. It is a fungal infection caused by Candida species, most often Candida albicans. While Candida is a normal part of the vaginal flora, an infection occurs when an imbalance allows the fungus to multiply uncontrollably and penetrate the mucosal lining. Key factors that disrupt this balance include antibiotic use. Broad-spectrum antibiotics kill the good bacteria lactobacilli that normally keep yeast growth in check. Hormonal changes. Elevated estrogen levels during pregnancy, the use of high-dose estrogen birth control, or hormone therapy increase risk. Medical conditions, unmanaged diabetes due to extra sugar in urine, and weakened immune systems due to HIV, chemotherapy, or corticosteroids make individuals more susceptible. Lifestyle factors. Wearing tight, non-breathable clothing, staying in wet swimsuits, douching, and using scented hygiene products can promote yeast growth. Clinical presentation. The hallmark sign of a yeast infection is thick, white, clumpy vaginal discharge that resembles cottage cheese and is typically odorless. Other symptoms include intense vaginal and vulvar itching, burning, and soreness, erythema, redness and edema, swelling of the vulva, dysuria, burning during urination, and dyspareunia, pain during sexual intercourse. Severe cases may lead to visible fissures or tiny cracks in the skin of the vulva. Laboratory diagnosis. pH testing. Vaginal pH in yeast infections is typically normal, less than 4.5, helping distinguish it from bacterial vaginosis or trichomoniasis, where pH is usually elevated. Microscopy. Wet mount examination. A wet mount is performed by placing a drop of normal saline on a clean glass slide. A small sample of vaginal discharge is mixed with the saline, covered with a cover slip, and examined under a microscope. It allows visualization of budding yeast cells and pseudohyphae of Candida. As you can see in this picture, the pseudohyphae, budding yeast, pleomorphic leukocytes, and epithelial cells are visible. But also, normal saline wet amount helps us to exclude other causes of vaginitis, such as motile organisms of Trichomonas vaginalis, clue cells associated with bacterial vaginosis. For better visualization of fungal elements, a drop of 10% potassium hydroxide, KOH, can be added to another preparation. KOH dissolves epithelial cells and debris, but preserves the yeast cells and pseudohyphae, making them easier to observe microscopically. Here, in the 10% KOH preparation, we clearly notice the hyphae and budding yeast with a clear background. Culture. While not always necessary for simple cases, a yeast culture is the gold standard for confirming diagnosis. It is mandatory for recurrent cases, treatment failures, or when non-albicans species, which may be resistant to standard treatments, are suspected. Trichomonas vaginitis. This is the most common curable non-viral sexually transmitted infection globally. It is caused by the parasite Trichomonas vaginalis. Clinical presentation. Abnormal discharge. Yellow to green and frothy discharge with a foul smelling. Irritation. Intense itching, pruritus, burning and soreness of the vulva and vagina. Pain, burning during urination, dysuria, and pain during sexual intercourse, dyspareunia. Strawberry cervix. Tiny red spots on the cervix, which are highly specific to this infection, but visible to the naked eye in fewer than 5% of cases. Laboratory diagnosis. Vaginal pH. Usually elevated, greater than 4.5. Wet mount microscopy. A provider looks for motile trichomonads in a sample of discharge. Because the parasites lose motility quickly, the sample must be read within 10 to 20 minutes of collection. If there is a delay in examining the specimen, a transport or culture medium should be used. This helps maintain the viability of the parasite until laboratory examination. Commonly used media include Diamond's medium or in-pouch TV culture system. Rapid diagnostic tests. Trichomonas vaginalis can also be detected using rapid diagnostic tests. These tests are based on antigen detection from vaginal swab samples. Types of rapid test formats. Strip tests. A small test strip changes color if the parasite antigen is present. And cassette tests. A plastic cassette device that shows visible lines. Cytolytic vaginosis is a condition characterized by an overgrowth of lactobacilli, the resident bacteria usually considered protective of the vaginal environment. This overgrowth leads to extreme hyperacidity, pH less than or equal to 3.8, and the subsequent lysis, destruction, of vaginal epithelial cells, which creates the characteristic symptoms of the disorder. Clinical presentation. Cytolytic vaginosis is frequently misdiagnosed as vulvovaginal candidiasis because they share nearly identical symptoms, including intense itching, pruritus, burning and irritation, white, cheesy discharge, which some studies describe as thinner and more paste-like than the discharge seen in yeast infections, pain during intercourse, dyspareunia, and discomfort during urination, dysuria. Risk factors. Menstrual cycle phase. Symptoms are notoriously more severe during the luteal phase, the time between ovulation and menstruation. This is attributed to higher levels of progesterone and increased glycogen deposition, which fuels the overgrowth of lactobacilli. Diabetes mellitus. High serum glucose levels are thought to promote the overgrowth of lactobacilli, placing diabetic women at a higher risk. Hormonal status. Pregnancy and perimenopause are also associated with a higher incidence of the condition. Laboratory diagnosis. Key diagnostic criteria include an absence of Trichomonas, Gardnerella, and Candida, combined with a significant increase in the number of lactobacilli, evidence of cytolysis, the presence of bare or naked intermediate epithelial cell nuclei and cytoplasmic debris caused by cell destruction. As shown here in this image of Pap smear, lysis of epithelial cells which can be demonstrated as numerous bare nuclei and debris cytoplasm. False clue cells. Lactobacilli may adhere to epithelial cells, mimicking the clue cells of bacterial vaginosis, though they are distinguishable by the larger size of the lactobacilli. Vaginal pH. A very low and acidic pH, typically between 3.5 and 4.5. Because the signs of cytolytic vaginosis overlap significantly with vulvovaginal candidiasis, cultures are essential or recommended in all cases to determine if the two conditions coexist. Desquamative inflammatory vaginitis, a severe form of aerobic vaginitis, characterized by heavy colonization of facultative aerobic bacteria such as Group B Streptococcus, Escherichia coli, and Staphylococcus aureus. Absence of lactobacilli. Extreme mucosal inflammation. Occurs across reproductive and perimenopausal ages. May be idiopathic or linked to systemic autoimmune triggers. Atrophic vaginitis, also referred to as genitourinary syndrome of menopause. This is the thinning, drying, and inflammation of the vaginal walls caused by hypoestrogenism, estrogen deficiency. While most common in postmenopausal women, it can occur during lactation or other low estrogen states. Desquamative inflammatory vaginitis and atrophic vaginitis share features like an elevated vaginal pH, greater than 4.5, and the presence of parabasal cells on microscopy. Parabasal cells are small, immature squamous epithelial cells round or oval in shape. Also, depleted or absent lactobacilli, significant dyspareunia, signs of vaginal inflammation, burning, stinging. However, it also clarifies that while atrophic vaginitis is caused by hypoestrogenism, lack of estrogen, DIV occurs in women with normal estrogen levels and does not respond to estrogen therapy alone. Thank you for watching. Please like, subscribe, and turn on notifications to stay updated with my newest content.